You're pregnant! Yay! Congratulations! So hopefully you started a solid exercise program before you got pregnant, and now that you're in your first trimester, you're going to continue your great core strengthening program to keep you strong as your body grows and changes, and to help make labor and delivery easier. What you want to focus on during the first trimester is watching your fatigue levels. You'll probably be pretty tired. Monitor how your body feels, and don't push yourself too hard, but do try to be consistent with your strengthening program. You want to focus on the core, including the pelvic floor, the lower abdominals, the back muscles, the mid-back muscles, and the glutes back here. So let's start with some really basic exercises. The bird dog is the first one. You want to think about starting with your hands directly under your shoulders and your knees directly under your hips. And you want to pull your belly button up toward your spine. So don't let your belly hang. You want to bring your back flat and then pull your belly button up toward your spine. And hold your body, your trunk, completely steady as you lift opposite arm and leg out. Really reach toward opposite sides of the room with your arm and your leg. Keep your trunk and your body totally still as you reach opposite arm and leg. And you can do as many reps as you want of this exercise. I just want to show you how this looks. So going back and forth, you should really feel this in your whole core, your glutes, your mid and upper back, and breathe steadily as you do this. Think about keeping your back so still that you could have a hot cup of tea or something fabulous on your back, and that it wouldn't spill at all. Not a drop would spill because you're so still and steady through the core. All right, so moving into a bridge. You're still fine lying on your back in the first trimester, as long as it's comfortable. So think about engaging your pelvic floor, your glutes, and roll up one vertebrae at a time. Hold it here and pulse your hips up toward the ceiling to really feel it deep in the glutes. Your hamstrings will feel it even. And 5, 4, 3, 2, 1. Roll it down and roll out your back. Pull your knees up to your chest. You could certainly do that again, but let's move into a side plank or a side bridge. Plank bridge, you can call it either one. So bring your elbow directly under your shoulder. Knees and body are in a line. Pull your abs gently in, and you want to come up into a nice straight like a plank position. Here you can also pulse it up. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And hold it. Again, your abdominals are drawn in and your elbow directly under your shoulder. And lower down. Switch sides. Elbow directly under your shoulder, body in a line, and lift up and pulse it. And 5, 4, 3, 2, 1. Hold it up here. Keep breathing steadily. Don't ever hold your breath. Keep those abs drawn in. Watch that elbow. Make sure it's directly under your shoulder. And lower it down. Onto your stomach. And let's do a plank. So from your elbows and your toes, pull your abs in and lift up into a nice plank position. Hold it here. And keep those abdominals drawn in, holding it strong. Keep your neck long and your shoulders away from your ears. And slowly lower down. Relax for just a minute. If you're not comfortable being on your belly, of course, relax on your side. So just like that. Come up when you're ready. Let's do a different style of plank from your, if you can, if your wrists are okay with this. Sometimes the wrists swell a little bit in pregnancy. You can get swelling in the wrist joint. So if you have wrist pain, then you might not want to do this one. But if your wrists are okay, come up into a full plank and really draw those abdominals in. And let's bring one knee up and back. You can even cross, so you're bringing the opposite knee to the opposite elbow. Right knee to the left elbow, left knee to the right elbow. Breathe out every time you bring the knee, either across your body or just straight forward. Kind of depends on how big the belly's getting. Again, early in the first trimester, shouldn't be too much of a problem. All of these exercises are really intended for pretty early in the first trimester. And 5, 4, 3, 2, 1. And carefully lower down. Child's pose is a great resting pose. Just spread your knees apart to allow for your room for your belly. Hold it here. And then come on up. We're going to move into a really deep squat. So start by stretching out your feet. Sit up tall. Stretch out the bottom of your feet right here. And if you can, push back into a deep squat position. You can have a rolled up yoga mat or some pillows, cushions behind your heels if you need that support. But if you can drop your feet all the way onto the ground and be in this deep squat position, this is great for stretching and strengthening the core, low back, gluteal muscles, everything. So hold this position, and great position to do your Kegels. So focus on squeezing and lifting those pelvic floor muscles, the inside pelvic floor muscles that are being stretched. They're going to be stretched to the max during this pregnancy. So squeeze and lift and hold them strong, and then totally relax, release, and let them go. And repeat that. Let's just do 2 more times for now. So squeeze and lift the pelvic floor, hold it for 5, 4, 3, 2, 1, and now totally release, relax, let those pelvic floor muscles completely go. And let's do it again. Squeeze and lift the inside pelvic floor muscles like you're stopping the flow of urine or like you're pulling something into your body and holding it. And then now totally release and let them go. Take a deep breath and come down into a nice hip flexor stretch. So important to maintain your flexibility at any time, but especially, during pregnancy, you can get really tight in certain areas of your body. You can get really loose in other areas of your body. Everything is changing, so it's really important to focus on where your body needs stretching. Prenatal yoga is wonderful for pregnancy, for relaxation, and also just for maintaining the length of your muscles. So hold this deep hip flexor stretch. You can have both hands on one side of the front leg or one hand on either side. Then you can also try coming up, bringing your arms overhead. And down. Switch sides. Try to work your hips forward. And let's bring hands in front of your chest and then arms overhead. great stretch for your hips and for your trunk is the Mermaid Stretch, side bending, back and forth. And so let's just do one more time on each side with the legs in this position, and then you can switch legs. And again, back and forth. And one more time. And that's so good for your back if you're having pain in there. Sometimes, again, you can get cramps on one side or the other. Maybe you're carrying yourself a funny way, and these muscles over here get cramped up and tight. This is a great one to evenly stretch the hips and the trunk. So the last stretch idea I have for you is a hamstring stretch. You can do a hamstring stretch a number of ways, but just a seated hamstring stretch is great. So think about sitting up tall on your sit bones, and then really breathe in, bring your arms overhead, and as you exhale, hinge forward from your hips. So try not to round your back too much, and think about bringing your chest forward as your sit bones and your tailbone go back. So you're keeping your back flat and you're coming forward. And just be gentle with this. Think about breathing deeply and inhaling, looking up, exhaling, come a little bit farther forward. You can always do hamstring stretches standing up. There's ways you can do hamstring stretches standing up. I could show you that another time. You can do it lying on your back if you're still comfortable lying on your back. But it's important to stretch the back of the legs. Some serious leg cramping and leg problems, sciatica, the nerve pain that runs down the back of your leg can occur during pregnancy, and keeping the hamstrings stretched out and flexible is a part of helping to prevent those problems. So let's switch sides. So sit tall on your sit bones, arms overhead, breathe in, and breathe out as you fold forward from your hips, working your chest down and your sit bones and your tailbones back. Hold it here. Again, breathe in and breathe out. Come a little bit farther if you can. And come on up. Again, I can't stress enough how important it is for you to keep up the core strength, the glutes, the pelvic floor muscles, do those Kegels, and that'll help keep you in control of your bodily functions during pregnancy. It'll keep you dry, it'll keep you from leaking, and it will make your childbirth easier if you're able to learn how to control the muscles of the abdominal area and the pelvic floor, knowing how to contract them at the right times, and of course relax them too. So good luck.